Thanks so much, Nina. Merci tout le monde. Thanks for being here. We're commemorating today the 1 year anniversary of COVID-19. And I think it's a very appropriate time to reflect on the impact of COVID-19. It has hit everyone in our country. It's hit people across the world, but it's hit certain people harder. And it's clear that it's hit our seniors in long-term care the hardest. And that is a national shame. We know it's also impacted our frontline workers, whether our grocery store workers or our healthcare workers that have put their lives at risk to protect us. And we know that it is disproportionately impacted Indigenous and racialized people, people who work in jobs that bring the food and supply and goods that we need. Logistics, transportation, warehouses are often racialized people who are more likely to get sick and get infected by COVID-19. And then Indigenous communities that have been worried and anxious about what a outbreak would mean to communities that have faced historic and ongoing injustice, so they don't have the same access to healthcare. So when we reflect on all these communities and people that have been so hard hit, we've got to think about solutions, things that we need to do now to help communities and people immediately, but also prevent this from ever happening again. We've got to remove profit out of long-term care. We've got to better protect our seniors with national standards of care. We need to make sure workers that take care of our seniors are paid a good salary. We know that work conditions are directly connected to health and care conditions. We know that we've got to do better to make sure we support the people who've lost their jobs, and women have been some of the hardest hit when it comes to job loss. So we need to invest in childcare. We need to make sure we produce the vaccine and drugs, critical drugs here in Canada. We need to make sure we own that ability to produce it. There's so much that we need to do, but we need to really focus on committing to preventing this from ever happening again. Donc, quand on pense aujourd'hui sur le fait que c'est le premier anniversaire de la pandémie, on pense de tout le monde qui a été frappé fort par la COVID-19. Mais on sait qu'il y a des communautés qui étaient les plus frappées et on pense de nos aînés. Le fait qu'on ait perdu plus de 22 000 personnes et la plupart étaient nos aînés, particulièrement dans les centres de soins de longue durée. Et on pense aussi des travailleurs de première ligne, nos travailleurs en santé et qui travaillent dans les magasins. On pense aussi du fait que c'était les communautés autochtones et les communautés racisées qui aussi, c'était un des plus frappés. Les communautés autochtones parce qu'ils ont peur que s'il y a une outbreak, si la pandémie touche la communauté, la COVID-19 touche la communauté, ça veut dire un grand impact parce qu'ils n'ont pas les mêmes accès aux services de santé. Et aussi, la communauté racisée, c'est une des plus frappées parce qu'ils travaillent dans le transport et dans les grands bâtiments. Et ils ont des emplois où ils ne peuvent pas travailler chez eux à la maison et ils doivent travailler dans les endroits où on sait que dans les milieux de travail, c'est une plus grande menace de partager la COVID-19. Donc, ce qu'on doit faire aujourd'hui, quand on pense de l'impact de la COVID-19, on doit penser de comment on peut prévenir ces mêmes choses dans l'avenir, comment on peut prévenir les mêmes impacts. Donc, il faut tout de suite protéger et soigner nos aînés en éliminant tout de suite le profit dans les centres de soins de longue durée et s'assurer qu'on a des normes, des standards nationaux pour prendre mieux soin de nos aînés. On doit payer les travailleurs en première ligne un bon salaire pour qu'ils puissent faire le travail nécessaire. On doit assurer qu'on fait des investissements dans les services de garde pour aider les femmes pour retourner au travail. On doit avoir la capacité de produire un vaccin chez nous au Canada. Ce sont les choses qu'on doit faire. Et nous, les néo-démocrates, on va continuer de se battre pour les familles, pour prévenir ces sortes d'impacts dans l'avenir. Merci beaucoup. Thank you so much. And just today, thinking about the over 22,000 Canadians who lost their life, in memory of those who lost their life, we've got to commit to ensuring that this sort of pandemic never has the same impact on Canadians ever again. And there's some clear ways we can do that. Thank you so much. And I'm ready for your questions.
Thank you very much. So I would like to invite the members of the media, if you have a question, to please use the raise hand function at the bottom of the page. J'invite les membres des médias d'utiliser la fonction lever la main si vous avez une question. Nous allons commencer avec Hélène Buzetti avec la coop L'Information. C'est à vous.
Oui, bonjour, Monsieur Singh.
Bonjour.
Je voulais juste savoir, aujourd'hui, c'est le débat sur l'aide médicale à mourir. On sait qu'il y aura un vote en soirée. Je voulais savoir comment vos troupes allaient voter pour ce projet de loi. Merci.
On va voter contre les amendements du Sénat.
OK, et contre les amendements du Sénat et donc, puisqu'ils vont passer, contre le projet de loi, si je comprends bien?
Le projet de loi en général était on a déjà voté. Donc, je comprends que c'est seulement les amendements et on va voter contre ça. C'est une situation tellement difficile. Comme j'ai dit, je ne pense pas que le Sénat doit faire le travail des élus. Et on a dit au gouvernement qu'on doit avoir plus de protection pour la communauté handicapée. On a proposé une solution de donner $2 000 au moins, d'augmenter l'appui jusqu'à $2 000 pour les communautés handicapées. C'est important de les soigner, de les aider. Et c'est un projet de loi important. On comprend ça, mais on comprend les défis aussi.
Thank you very much. Next, I have Chris Reynolds with the Canadian Press. Please go ahead.
Hi, Mr. Singh. I was hoping you could basically repeat that response in English, please.
Sure. So we will not be voting in favor of the Senate amendments. We've said that we want to see more supports for people living with disabilities. We propose the solution to increase the help that goes to people living with disabilities to a $2,000 a month, something that would give dignity and support to people that are facing challenges, but just need extra support to be able to overcome those challenges. And we don't believe that the Senate should be doing the work of elected officials, and that's why we're voting against the Senate amendments.
I'm also wondering, we've been hearing a lot, we've been getting a lot of resistance from the Kielburger brothers about appearing before the Ethics Committee in Parliament, or we've been hearing that resistance voiced. I'm just wondering to what extent you think it's essential that the Kielburger brothers appear before that committee to answer further questions about their organization.
Well, I think it's essential that any witness that has been asked to come before committee comes before committee. That is fundamental. And with respect to there's still a lot of questions that people have that they want to see answered. At the end of the day, young people suffered when the Liberal government made a decision that in a lot of people's minds was clearly a conflict of interest and something very obvious, that in doing so, they really didn't show their commitment to helping students and young people. They still could actually deliver some programs. There's still money that they earmark that should go towards helping students right now. We want to see a moratorium immediately, an end to any repayments on student loans during this pandemic. That should be a basic thing that should happen. We've seen the states already move to do that. We passed a motion to get that done here in Canada. That should happen right away, but we need to help out students. And it looks like the Liberals were too closely aligned, too busy helping themselves, and they ended up hurting students, and that's a problem here.
Chris, do you have a follow-up?
Oh, thanks. Yeah, I guess another thing I was wondering about is I see that Bill C-24 has got unanimous consent to head through committee tonight. That's regarding the EI boost and keeping voluntary travelers from getting sick. I was just hoping you could speak to the urgency of both those things.
Yeah, we need to deliver help as quickly as possible to people. And we know that there's still lots of people that are hard hit. We've been saying for a long time that we need really specific supports to continue. We need to find ways to improve the paid sick leave is another thing that I really want to see happen. There's some changes in this law, in this bill that we obviously support, and loopholes that needed to be closed. And so we were happy to move that along. But we still, one of the things that the Liberal government has yet to have done, and that still needs to be done, is make the paid sick leave program better. It's something that widely has been called as one of the most effective tools to reducing the spread of workplace spread of infection. and that's to make sure it's more flexible, easier to obtain, quicker payments, and the flexibility, meaning that people should be able to take a day or two to figure out if their symptoms resolve. So that's still something that we need to work on. But yes, we're happy to support bills that help people get the support they need.
Thank you.
Thanks.
Thank you very much. I'd like to remind journalists, if you have a question, to please use the raise hand function at the bottom of the page. J'aimerais juste rappeler les journalistes, si vous avez une question, de veuillez utiliser la fonction lever la main au bas de la page. Je ne vois plus de questions. I don't see any more questions. Jagmeet, would you like to say a few words before we close?
Certainly. Thanks so much for being here again. And I just want to say again, remembering and reflecting on the 1-year anniversary of COVID-19, we've lost a lot. There's been a lot of people that have lost their lives. People have lost their jobs. Businesses have been forced to shut down, small businesses in particular. And we've seen a lot of pain. And we have to commit ourselves to real steps to prevent this from ever happening again, to prevent the same sort of impact. A lot of the problems that we are seeing are things that were problems in the past that were just exposed by COVID-19. Long-term care, childcare, these were existing problems. The fact there was not adequate supports, we need to make sure we fix them now and forever. Donc, dans cette pandémie, ce qu'on a vu, c'est des problèmes qui étaient là, et les problèmes existants, les problèmes qui étaient toujours là. Et la COVID-19 est seulement exposé ces problèmes qui étaient là. Donc, on doit prendre des mesures concrètes pour prévenir le même impact d'une pandémie dans l'avenir. Et on a une occasion de faire ça. Merci beaucoup. Thank you so much.
Jagmeet, I have one last question. Nous avons une dernière question, Hélène Buzetti, avec la coop de l'information.
Oui, excusez-moi, M. Singh, je vous laisse partir après. Mais je veux juste clarifier votre réponse sur le projet de loi de l'aide à mourir. Vous avez dit que vous êtes contre les modifications apportées par le Sénat. Je comprends, mais ce soir, c'est quand même le vote final. Donc, juste pour être clair, donc vous allez voter contre parce que vous n'êtes pas d'accord que le Sénat ait apporté des modifications, c'est ça?
Je pense qu'on a un peu de confusion là-dessus. Ma compréhension, c'est qu'on a déjà voté sur le projet de loi, donc c'est fini. On a déjà voté pour ça. Maintenant, c'est seulement un vote sur les amendements du Sénat parce qu'on ne peut pas revoter sur le projet de loi. On a déjà fait ça. C'est seulement question des amendements et on n'appuie pas les amendements du Sénat. Donc, dans ma compréhension, c'est la seule question. S'il y a des autres votes, notre équipe peut faire un suivi avec vous. Mais dans ma compréhension, c'est seulement un vote sur les amendements du Sénat et on a déjà voté sur le projet de loi.
Hélène, avais-tu un suivi?
Non, c'est correct. Merci.
Merci. Alors, ceci met fin à la conférence de presse. This concludes the press conference. Thank you very much. Merci beaucoup.
Merci. Thank you.